Hey, so I thought I'd come on and do a video because a lot of people have been messaging me asking me about my weight loss, and I wanted to do a wee video on my experience. But just a warning, if you don't like anything icky or surgical or blood or guts, then just don't watch this video, and it's going to be pretty long, so if you don't want to watch it, it's cool. So in May I had an RNY gastric bypass. It wasn't my choice to have it done. I was sent by my neurologist because I have intracranial hypertension, and I was going down the road that I would have to have a shunt put in my brain to drain off the water. I'd had 16 lumbar punctures by that stage, and it was getting pretty like to the end of the road, and I was losing my sight, and they think that it's weight related, so they said that have the bypass first and then see how the headaches are, and then if it's still a problem then we can go for the shunt, but it's worth a try. So I was sent in for, I was a bit 2-year waiting list, and then I had about 5 appointments with my gastric surgeon, Dr. Bodner, and then I went in for a pre-op assessment, and I had the surgery on the 22nd of May. I was really scared, so scared. Obviously, it was meant to be an hour and a half, and it took 4 hours. Now I was having my hiatal hernia fixed, and I was meant to have my gallbladder out, but because the surgery took so long, they're going to do it at a later date, an outpatient appointment. Because I had a wall of scar tissue that they had to cut through. I had 6 incisions, so that's why the surgery took so long. I woke up from the surgery in a lot of pain, but I was out of it kind of for the first day. I had a huge drain coming out of my stomach. Insert picture here. I'll also insert a diagram of what the RNY gastric bypass is. Here, it's basically, they took away 85% of my stomach, so I only have 15% left, and they rerouted my lower intestine to meet my little pouch at the top, and then they put my digestive tube down to my lower intestine, because that's where I digest food now. I don't digest food in my stomach anymore, and obviously it's major surgery, and it was super painful. When I woke up, I was so thirsty, and they wouldn't let me drink any water for 24 hours. That sucked. Really sore. I was in for 3 days, and then I was released home. I went home to my mom's because so she could take care of me, and she did such a good job. And I'm going to insert a picture of what my stomach looked like. It was so distended and bloated from the gas and swelling, and it was so painful. It was really painful. I couldn't eat anything for 2 weeks. I had to only have fluids, and then I was on puree for 2 weeks, and then I was on soft food for 2 weeks, and then I was allowed to eat normal food. But I cried so much because all I wanted to do was eat something crunchy. When you're only eating soft food and liquids, it's just so hard. And obviously I love food. I wouldn't have been a binge eater or an overeater or anything like that. I just loved the wrong food. Like bread and cheese and carbs basically all the time. So yeah, I had a little cry, and especially it was 2 days after I got out of hospital. It was my 50th birthday, and I couldn't eat anything, and I couldn't have a glass of wine or anything, and it was so hard. But it's been tough. I went to the doctors and I cried, and I was like, I can't do this. I had very much remorse over having the surgery done at all. I still do a little bit, For the rest of my life, I have to take 6 or 7 tablets every day. Multivitamin, calcium, vitamin B12 shots. I have to take iron, vitamin D, collagen, biotin, a stomach liner. I've lost like 50% of my hair. My nails, obviously I get my nails done. These are my nails, but I have to have gel polish on them because they're so weak and brittle. I have varicose veins now. My veins are collapsing in my legs. It's so hard not being able to eat. I don't absorb nutrients anymore. So sometimes if I'm standing for a long time, I feel really weak, like I'm gonna faint. And like even going into a restaurant, or you're only having a starter and then you're only having a quarter of the starter, and then the waiter's saying, was there something wrong with the food? And you're like, no, I'm just not very hungry. And they're like, oh yeah, okay. This is another major thing. I can't eat and drink at the same time. So if I have something to drink, like a cup of tea, I have to put a timer. So if I have something to drink, like a cup of tea, I have to put a timer on for half an hour, and then I can eat. And then once I've finished eating completely, I have to put a timer on for half an hour, and then I can drink again. For the rest of my life, I can't eat and drink at the same time, and that's so hard. When you're having dinner and you want to have a glass of water or a glass of milk or a cup of tea, can't do that anymore, because what happens is the food goes into my pouch. If there's any fluid there, or if I drink fluids, it just flushes it out straight away, and I get what's called dumping syndrome, which is exactly what it sounds like. I literally dump everything out of my system. I can't eat anything sweet or sugary. I can't eat anything fatty, or I will throw up, or it will go the other way. And it's really, really hard. I can only eat, at the start I could only eat 10 ounce cup, which is this much. Now I can eat a little bit more now, but not much. And for people that say that I took the easy way out, this has been the hardest thing I have ever done in my whole life. See, lumbar puncture's nothing compared to this, and my life has changed forever. It's not an easy way out. It's one of the hardest ways out. But a gastric bypass is not just, oh, they cut out my stomach so I can't eat and I lose weight. You have to put the effort in. I have to eat 100 grams of protein a day. You should retrain your mind to think, right, I have to eat protein first, and then the veg, and then if I can, the carbs. But I often don't get to the carbs because I'm so full. And then like I could eat 5 packets of crisps easily, but am I getting any nutrition out of that? No. So would I rather have a bit of chicken? Yes. Or an egg, or cottage cheese or something. So the gastric bypass is just a tool to help you. And yes, I have lost nearly 9 stone with it, and I wouldn't have been able to do that on my own. Absolutely. It is an amazing tool to help you to lose weight. But your stomach does stretch over time, and you will be able to eat larger amounts as the time goes on. But you have to remember that you've gone through this so much pain and torture, and it's really been hard. Like, you're not going to give all that away just to eat a burger. Like, there's no point. What was the point in having the surgery? But good news is, I usually have a lumbar puncture every 6 months, and my last lumbar puncture was December, not just past the year before. So I'm doing good now. I do have the odd headache, and I do still get the injections in my head to freeze the nerve endings every 3 months, so that does help. But so far so good, no lumbar punctures. It's a long process, and I know hopefully in October, November, I will be going to Lithuania to have plastic surgery done and get new boobs. And I'm having a full 360 body lift, and that's where they cut you the whole way around and take off big belts of skin, and they pull you up like trousers. It's going to be super painful. But listen, it has to be done. There's a lot of excess skin, and I don't feel like a gastric bypass is not just about losing weight. It's a physical thing, but it's also a mental thing, because I was always a confident plus size girl, and I haven't been skinny since my early 20s. So this is all very foreign to me. I'm not used to having really tiny arms and really tiny legs, and I think my face looks gaunt now. Everyone says that I look amazing, like, and I know I probably do, but when you're so used to being puffed out, like my boobs are half gone, my ass is completely gone, um, but you know, I can't put my stomach back in, so you know, this is it for life. So obviously I do need to have plastic surgery, and I'm getting them done hopefully October, November, and I'll feel a bit more confident when I have boobs. And yeah, I don't know if I'm gonna need an arm lift and a thigh lift, but they won't do them all at the same time. So that will have to be something I think about maybe next year or the year after, but I'm not too fussed. They're not that bad, like, so it's not too bad. So it's still a long journey ahead, but I'm really proud of myself for having come through it. And anybody thinking of getting it done, I would never get this done again, ever. I would rather be a fat girl and have lumbar punctures, being honest. Like, it has been so hard, and just, you know, but it's done now, so there's not much I can do. But yeah, I'm looking forward to it. It's harder now trying to lose the last stone, because obviously I can eat a bit more, and well, I have to put the effort in. I have to go to the gym, I have to walk. It's not just an easy fix, like, you have to put the effort in as well. And luckily I'm low enough in weight that exercising is now fun for me. It's not like I'm gonna have a heart attack and stop breathing. Like, it's easier. Yeah, it's easier now, so that's a good thing. So yeah, that's my story, and if you're thinking of getting it done, that's cool. Really research it and understand that you're going to be a changed person for the rest of your life, and it's really hard. It does work, but at what cost? Anyway, thanks for listening.